Nursing Care Plan on Congestive Heart Failure. Nursing Assessment. 1. Patient History. Obtain a detailed medical history, onset and duration of symptoms, previous cardiac events, coexisting medical conditions, and medication history. 2. Vital signs. Measure and record the patient's blood pressure, heart rate, respiratory rate, and temperature. Monitor for any abnormalities, such as hypertension or tachycardia. Point 3. Respiratory assessment. Evaluate the patient's breathing pattern, presence of dyspnea, shortness of breath, orthopnea. Assess lung sounds for crackles, wheezing, or decreased breath sounds. 4. Fluid status. Assess for signs of fluid overload, peripheral edema, swelling in the legs, ankles, or feet, ascites, abdominal swelling due to fluid accumulation. 5. Auscultation of the heart. Assess patient's heart sounds for any abnormal rhythms. 6. Mental status. Evaluate the patient's level of consciousness, orientation, and cognitive function. 7. Activity tolerance. Assess the patient's ability to perform activities of daily living, ADLs, and any limitations or fatigue experienced during exertion. 8. Laboratory tests. Monitor lab results, electrolyte levels, renal function, BUN and creatinine, liver function, AST and ALT, brain natriuretic peptide, BNP, and complete blood count, CBC. Nursing diagnosis. 1. Decreased cardiac output related to impaired contractility of the heart. 2. Impaired gas exchange related to alveolar edema due to elevated ventricular pressure. 3. Fluid volume excess related to sodium and water retention. 4. Activity intolerance related to oxygen supply and demand imbalance. Nursing diagnosis. 1. Decreased cardiac output related to impaired contractility of the heart goals to maintain adequate cardiac output. Planning. Monitor vital signs. Provide physical and emotional rest. Evaluate progression of ventricular failure. Observe signs and symptoms of reduced peripheral tissue perfusion, color, warmth, capillary refill time. Administer medication as prescribed. Monitor response of the patient. Implementation. Monitored vital signs. Patient kept semi-recumbent position. Observed signs and symptoms of reduced peripheral tissue perfusion. Administered medication as prescribed. Monitored response of the patient. Evaluation. Blood pressure. Pulse rate. Respiratory rate. Capillary refill time. Skin color. Nursing diagnosis. 2. Impaired gas exchange related to alveolar edema due to elevated ventricular pressure. Goals: to improve oxygenation. Planning. Elevate bedhead. Support lower arms with pillows. Monitor vital signs. Auscultate breath sounds, rhythm. Assist for arterial blood gases. Offer small frequent feeds. Administer oxygen and medication. Implementation. Elevate D bedhead. Supported lower arms with pillows. Monitored vital signs. Auscultated breath sounds, rhythm. Assisted for arterial blood gases. Offered small frequent feeds. Administered oxygen as prescribed. Administer medication as prescribed. Evaluation. Breath sounds, blood pressure, pulse rate, respiratory rate, SpO2, level. Nursing diagnosis. 3. Fluid volume excess related to sodium and water retention. Goals: to restore fluid balance. Planning. Administer diuretic as prescribed. Monitor vital signs. Monitor input-output chart. Assess weakness, muscle cramps. Observe side effects of diuretic. Monitor pitting edema, abdominal pain. Offer low-salt diet. Implementation. Administer diuretic as prescribed. Monitor vital signs. Monitor input-output chart. Assess weakness, muscle cramps. Observe side effects of diuretic. Monitor pitting edema, abdominal pain. Offer low-salt diet. Evaluation, input and output with time period. Nursing diagnosis. 4. Activity intolerance related to oxygen supply and demand imbalance. Goals: to improve activity level. Planning. Increase activity gradually. Monitor vital signs. Observe dyspnea, chest pain during activities. Provide adequate rest. Implementation. Increased activity gradually. Monitored vital signs. Observed dyspnea, chest pain during activities. Provided adequate rest. Evaluation. Patient verbalized any discomfort during activities.